Hello viewers across the globe, I am your usual host, Nurse Midwife Mata Febo Paco. In my first episode, I explained to us what maternal mortality is. So I want you to visit the first episode for you to get a clear understanding, clear explanation of what I'm about to talk about. Now, maternal death, briefly, it's the death of a woman during pregnancy, labor, or after labor, after delivery. We call it postpartum. Now, during pregnancy, a woman could bleed to death during pregnancy. Bleeding is one of the number one major cause of maternal death, which we must put a stop to it. Now, bleeding during pregnancy now, a woman could bleed at the early stage of pregnancy. You may not know the cause of the bleeding. So once you notice any slight bleeding, no matter how little it is, please, my fellow women, don't ignore it. Immediately move to the hospital so that they can diagnose you, check you to know the major cause, the reason why you are bleeding. That's all I want you to know. You may not know why you are bleeding, but when you go to the hospital on time, any detection of why you are bleeding will be resolved. You could be bleeding, it could be an implantation bleeding, because we have causes of bleeding during early pregnancy. Implantation bleeding, ectopic pregnancy could cause bleeding, miscarriages could lead to bleeding, the woman could bleed to death. We have bleeding from the cervix, the woman may be bleeding from the cervix, which could also lead to death. So if you notice any bleeding during pregnancy, please run, don't even move. When I mean run, be fast, go to the hospital. In fact, even if you don't have transport, if you don't have means of transportation, you can call on us. Our organization is there for you at any time, 24-hour service. We will get a means of transportation and move you immediately to the hospital when you notice any bleeding during pregnancy. You can also bleed maybe from your 6 months. You may decide to say, thank God I didn't bleed in my early stage of pregnancy. Right from 6 months you could bleed. And there are some two major causes of bleeding during that period, when you are 6 months pregnant till prior to when you give birth to your child. It could be placenta previa, it could be placenta accrotio. You don't know the meaning of all these things, but just know that whenever you notice any bleeding, please take action immediately and go to the hospital. It's not something they manage at home. Now, we want to talk about bleeding during delivery. This is one of the major points I really want about. Bleeding during delivery. Women, you carry pregnancy from the first month to the 9th month of delivery, to the 9th month. And after that, you will now still go ahead, look for quacks to come and conduct delivery for you. After all the discomfort, the sleepless nights, and at the end, you go look for quacks to come and conduct deliveries for you. Deliveries is not something you joke about. It's not something you play with. It's not a playing thing. You have to take it very serious. If you want to give birth to your child, look for experienced midwives. Midwives, nurses, they are licensed to conduct deliveries. They are the ones that are professionals in the aspect of conducting deliveries. So why don't you go and get people, professionals, to conduct your deliveries for you, instead of joking and playing with your life? Remember, we have only one life, and once you die, my dear, you are not coming back again. That's the true fact. And for your own information, the husband will get married to another wife because he's licensed to do it. He has every right to get married to another woman. So please be wise. Be wise. When it's time for you to deliver, look for professionals to conduct your deliveries for you. Go to the hospital. Even if you don't want to go to the hospital, you have every right to give birth at home. It's not all deliveries that are conducted at home. The quacks don't know this. For example, a woman that is carrying a multiple gestation, you are carrying twins, you've gone for scanning, the doctor had told you that you are carrying twin gestation or triplets, you now still want to stay home to deliver? No, capital no. You are not to give birth at home. You have to give birth in the hospital, because anything could go wrong. A woman that is giving birth for the first time should not stay home, to deliver. There are many reasons why you shouldn't give birth at home, and there are also reasons why you can still give birth at home. even if you called you and your midwife to come and conduct your deliveries for you at home, and when we check you and examine you, we discover that you are not fit for home delivery, my dear, we will not conduct delivery at home. We won't conduct it in your home. Better still, we'll move you to the hospital, because we are after your life, your life and the life of your baby. So please, I want us to take note of this. Now, briefly, I want to talk to us about bleeding during labor. Looking at this baby, we just finished conducting the delivery. Just finished conducting the delivery of this lovely baby. She's a baby girl. Now, looking at her, she's looking beautiful, isn't it? The mother is calm. Looking at the mother, she's calm. But you won't know the drama that took place before this baby came out. No, now, so this woman had just put to bed. Just a few minutes ago, she had just put to bed. Now, the baby is fine. The mother is fine. Both are alive and healthy. This is our utmost goal as midwives. Now, the placenta also is out. This is the placenta of the baby. Now, when the baby comes out from the woman, when the baby is being delivered, the placenta is left inside. This is what we call placenta. This is what is called placenta. This is where the baby feeds from. The baby gets his nutrients or her nutrients from the placenta. So once the baby is out, the work of the placenta is finished. Now we have to deliver the placenta. Now this is a critical stage. There was a time I was conducting a delivery for a patient, and after the baby was out, the woman said, "Madam, can I stand up and go?" I looked at her and I laughed, because she was ignorant of it. She didn't even know that there is another thing called placenta, which is inside the womb that must be delivered. So along the line, I immediately told her that, "Madam, we have not finished though. Placenta is inside." That means I got to know that she didn't even know what they call placenta. So some women may be ignorant of what we call placenta. That's why I'm showing it to us. After the baby is out, there's what we call placenta that needs to be delivered. And it needs expertise. It needs professionals to deliver the placenta, because this could make the woman bleed to death. The woman could bleed to death. The placenta, some of the placenta, the membrane, may be remaining inside the woman's uterus that you may not know. That if you go and meet quacks to conduct delivery for you, something may go wrong. Sometimes even if the placenta is inside and refuse to come out, we call it retained placenta. There are methods, there are tactics we use in delivering the placenta in case the placenta refuses to separate from the uterus. So you have to be careful. This is your life we are talking about here. You don't just call anyhow person to come and conduct deliveries for you after the inconveniences you've gone through, after the pain you've gone through. So let's be wise, women, because this thing the woman could bleed to death. So this placenta is complete. We have delivered it. I have checked her. Even when the time comes for her to be discharged, we will still check her again to make sure that she's fine and healthy, to ensure that she is not bleeding, because bleeding is a major cause of maternal death, which we must put a stop to it. So talking about postpartum hemorrhage now, the woman, after the woman has delivered, some of them will even get home and suddenly they start experiencing bleeding again. So that's why we are always taking care of them, ensure that they are fine before we discharge them home, because everything must be properly done. The woman could bleed even after delivery. So even if you notice any sign of bleeding, just run. Don't even walk. When I mean run, be fast about it. Don't joke with it. You know, women have this "I don't care" attitude. They just see slight bleeding, they say it's just small. There's nothing called small when it comes to bleeding, because it will increase. From small, it increases, and it increases before you know it, you pack off. So please, let's be wise, women. So don't forget to follow us on our social media platform. We are here for you. We are after your life and the life of your baby. So you can call on us at any time, and we'll always be there for you. At any time, we are available. It's a 24-hour service. We will give you quality care that you deserve. Even if you want to deliver at home, you have every right. But we will check you, we will examine you, and we will tell you the truth. If you are fit for home delivery, we will conduct delivery for you in your home. If your home is okay, we'll go ahead and conduct it. But if you are not fit for home delivery, we will not conduct delivery at home. We will move you immediately to the hospital. So let's be wise, women. Let us come together and say no to maternal death. Women must stop dying during childbirth. Enough is enough. Women must stay alive to take care of their children. So thank you all for listening. In our next episode, I will still explain to us the other causes I promised earlier on. I've told you that I will explain to us all the causes of maternal death. I've explained what we call bleeding. Now I'm going to explain in the next series. I will talk to us about sepsis and other causes. So please stay tuned. Thank you all for